Assalamualaikum warahmatullahi wabarakatuh. Hi guys, good morning or anytime that you watch this video. So I'm Zhafira Junannisa. I'm going to present you about my research-based paper titled as UMY IPIREL Students Batch 2020 Responses on Health Protocol During COVID-19 Pandemic. To give you a little bit of background, as we know, the COVID-19 pandemic has made such a huge impact to the world. This pandemic itself started from an epidemic occurred in the city of Wuhan, China. There is a market where all kind of different animals for different purposes are bought and sold, such as bats and civets, that were considered to be the source of where this virus came from. The severity of the symptoms caused by this virus infection then makes it spread rapidly, and it did not take long for the declaration of the COVID-19 become pandemic. In preventing the transmission of the virus that causes this pandemic, we have made many efforts, such as doing research to make vaccination or vaccine, as well as establishing and implementing health protocols. Continuing to the context of the students' responses. So university is a place where students can develop themselves as much as possible before entering the real career world. But the university activities such as social interactions and events for students to develop their skills can be quite tricky to be held because everything is based on e-learning due to the health protocols or online-based learning. Because of that, there is a high chance where the students have almost no time to get away from the radiation exposure of their laptop, monitor, and smartphone, which, based on Liu, Li, Chen, and Deng's study, might lower the ability of their eyes to focus and even for students to develop myopia. The recent studies I have found discussed about the impact of the pandemic health protocols on students from kindergarten above in China and Canada, with none talks about the impact to the International Program of International Relations or IPRO students of UMY or University of Muhammadiyah Yogyakarta, where every year it holds new students admissions, obviously, with the introduction activities such as OSD, MATAF, as well as the obligation for international program students, which is to do student exchange to go abroad. Thus, this research is aiming to find the impact felt by UMY IPRO students batch 2020 based on their response to the health protocols of COVID-19 and carrying out their obligations to participate in campus activities. So I'm going to answer these two research questions. How do UMY IPIREL students batch 2020 respond to the existence of health protocols during the COVID-19 pandemic? As well as what are the challenges faced by UMY IPIREL students batch 2020 when enforcing the health protocols? So the theoretical framework. Here, the health protocols by means are regulations for us to maintain our own health as well as others' individual health by preventing the transmission of COVID-19. WHO or World Health Organization has provided what called as advice for the public to wear mask, get vaccinated, and stay away from 3C's space, which are closed, crowded, or places that involve close contact. And then second one is the students in obeying health protocols. So in doing the health protocols, students have to do their study indoor or in their room or in their house by using their gadget to perform online learning. Then when they had to go to campus to do things such as administration stuffs or organizational agenda, they have to wash their hands in the provided place and check their body temperature to ensure that they are not in fever, which is one of the symptoms of when people got infected by COVID-19, and to ensure that they are healthy and clean. So the empirical review or journal or study that I found, there's one that talks about the impact of the existing health protocols to students regarding their eye health was done by Liu, Li Chen, and Deng mentioned that if anyone spent average screen time of 3.9 hours, they could have the symptoms of myopia. At today's range of time, students also feel more attached and use their gadgets longer than what should have been. So proven with the subjects or the respondents of their study that the students' outdoor activity is only at 1 to 3 times per week. And the second study done by Bertrand and his acquaintances found that when carrying out the e-learning or online-based learning or any activities that were held virtually, students tended to consume snacks and junk food without portioning it out. So this results to the average daily intake of total 125 survey participants fall off. So the research method that I use in this paper is that so this research was conducted specifically focused on the case of UMY IPIREL students batch 2020 by using the quantitative method to study about the responses on the health protocols of COVID-19, and a questionnaire survey was filled out by the students who are willing to share their own opinion towards the issue. The questions included the use of frequency, yes or no, as well as agree or disagree questions. And this questionnaire was distributed only towards IPL UMY students batch 2020 via WhatsApp. So the results, here I have shown you two charts from many questions drawn from the questionnaire. We can say all students already obey the health protocols, even though as we can see there's one who rarely did it, which is possible occurrences to how the pandemic condition is lately today. The second chart show their view with regard to the health protocols, that even when they always carrying it out, they do not lose their healthy lifestyles that they have been implementing. So starting off my discussion. So the study aims to find the response of UMY IPL students batch 2020 about the health protocols enforced during the COVID-19 pandemic. From the results, I can pull a line that almost all students have no objection and consistently follow the health protocols such as wearing masks, mandatory vaccinations, and conducting online course activities in an orderly manner. The response on health protocols affecting their healthy lifestyle were matched with them do not feel their social and organizational activities are limited. Besides, the protocols makes them besides the protocols makes them more aware of the importance of their health, and they actually did not realize any significant impact towards their attention on the food they consume, as well as eye health, even when they spend long hours to do the online classes and assignments. So in my analysis, these attitudes were corresponding to the condition of pandemic which has subsided. So nowadays, flight and travel restrictions are no longer in place strictly. So International Program of International Relations students batch 2020 now are able to do student exchange obligations offline. So for them to go abroad, as mentioned in the research done by Koi Tia and Hong that I found, offline classes and direct interaction will help students to understand the material better, as well as for them to communicate more easily, so they can ask the material if they don't understand enough to the lecturer. And the recovery of the pandemic can be felt by many IPREL students whom now were abroad doing study as an exchange student. So looking at the responses in the results of the questionnaire included UMY IPREL students batch 2020 responses on their eye health, where they did not feel a decreasing to their eye health. And I see this as a form of adaptation to online learning system. So therefore, even when they spend a long time staring at their gadgets, staring at their laptop and smartphone, they do not realize their eyes have the possibility of myopia due to absorb radiation from the monitor and close distance focus for a long time. And supported with the previously mentioned research by Liu, Li Chan, and Dang, that nearsighted or myopia and any other eye health complications basically are considered as a less visible vision health concern. And although the students have to undergo health protocols, there seem to be no challenges faced by them, and the impact they experience is going in a positive direction. So to conclude, my discussion and my research-based paper, this study shows the effect of the existence of COVID-19 pandemic health protocols on UMI across students batch 2020. That students did not lose their healthy lifestyles and instead became more aware of their health. And the world condition that's starting to get back to normal life with the health protocols become more relaxed also helped them to not feel their social activities and basically any activities for them as IPIREL students being restricted. And this shows that the students themselves succeeded on obeying the health protocols while maintaining to be active students. So thus, in all conditions, our health should be prioritized. Even when there is any health regulation, it should be taken as a good purpose of for our lives. Also, based on this research, I want to recommend for future researchers to investigate how to be a good student while preserving and protecting their physical health and mental health. Uh, well, if the researchers had a long time to do the research, they might do both. And I recommend to use mixed research methods to get effective, maybe like tips from the students' very own experience. So that's all from me, and I hope you understand what I'm delivering. And here's my paper. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.